So we got a trauma patient. All our PPE is on. The scene is safe. Police have already cleared the scene. The mechanism of the injury would be a motorcycle crash. There's only one patient, and we are gonna call EMS just because of the nature of the incident. And we are gonna stabilize the spine just because of it was a motor vehicle crash. So any neck trauma could be very possible. General impression of the patient is that he's lying on the floor unconscious. He seems unresponsive. No physical stimuli or verbal stimuli will get him to get any sort of reaction out of him. The chief complaint would be, you could say head trauma, just because of the nature of the incident. We could say he banged his head on the floor when he crashed, when he laid the bike down. The airway is open. I am seeing chest rise and fall, but I am gonna insert an oral adjunct just to make sure the head is clear. Since he is unconscious, we would just do a simple jaw thrust to open up the airway. After we get the airway open, I am gonna put him on a non-rebreather mask just because we want to keep getting some constant oxygen into his body. And then the breathing does seem to be a little labored, but yeah, just the simple O2 administration will probably do him good. The pulse is normal. The rate, rhythm, and quality, they all check out. The skin is fine. The temperature is fine. It's not cool or clammy. It seems normal as of right now. I'm doing a quick assessment and I see no major bleeding coming from anywhere, so I would not have to apply any shock therapy just because he doesn't seem like he is in shock yet. But I am going to transport him just because of the nature of the injury, and he is unconscious and it does seem like he has some head trauma. So I would then take note of the blood pressure, pulse, and respiratory rate just to get a baseline vitals counts for later on during our transportation, see how he is doing. We can't do the sample just because he is unconscious. And yeah, I would then move into my inspection phase. So I would start inspecting his head first. Make sure the ears, there's no secretions coming out of the ears. Check the occipital cavities. Make sure his eyes are good. Check his mouth. Go behind and feel the cervical spine just to make sure there's no abnormalities back there. And then from there, we would move on to palpating the chest, making sure there's no deformities or abnormalities. Make sure everything's okay. And we would oscillate it on all points just to make sure there is equal breathing. Make sure both lungs are working fine. Yeah, check for any noises that we could be hearing that could potentially put this patient at higher risk. From there, we're gonna go and palpate the abs just to make sure there's no abnormalities in there, anything we shouldn't be feeling. And from there, we're gonna do the pelvis. Make sure the pelvis is stable. Make sure it's not broken. Just palpate both sides. Make sure everything's good. And from there, we're gonna move on to the lower extremities. Go with his legs. Make sure nothing's broken or damaged. Everything seems good on this side. Got proper capillary refill. Same thing on the other side. Check for the same capillary refill. Make sure it's all good. And to go up to the upper extremities. Sort of move him around, see if everything's all right. Maybe we could say this one is broken, so leave that there. Check for capillary refill. It's broken, but there's still blood flow, so we'll move on. Same thing on this side, capillary refill. And after that, well, we would move on from this because it's not a life risk. It is broken, but it's not any danger to his life, so we'll move on. And we're gonna do a rollover, log roll, check his back. Just make sure everything's fine. And then check the rectum, make sure everything's all right down there. Then after that, we would manage any secondary damage. So, such as like this, we put this in a splint, make sure he's good to go, and then I would reassess every 5 minutes just to see how his vitals are doing, see how he's doing during transportation. Maybe he does regain consciousness. In that case, we would start off with doing the sample and stuff like that. But other than that, yeah, we would just transport him and get him to the hospital as soon as we can.